So what are the signs and symptoms we are going to find here? It depends upon the involvement of the anterior cranial fossa or middle cranial fossa or posterior cranial fossa. If you see the anterior cranial or anterior skull fractures, so if any fracture in the anterior, like a skull fractures in the frontal bone or maybe in the front of the anterior cranial fossa, so these are going to may chance to get the different symptoms. According to the symptoms, we can understand the symptom and also where got the injury. So here we have to diagnose clinically. So who already having the skull fracture, anterior skull fractures, they are going to get the Csf rhinoria. So it's going to be because of the skull fracture. So skull is beneath the skull, meninges is there, that is the dura mater, pia mater, and arachnoid mater. So in between the pia mater and arachnoid mater, the space is called as subarachnoid space. So in this space, cerebrospinal fluid is going to circulate throughout the body, that is throughout the central nervous system. So there, if any damage, any skull fracture, any spine injury, also may damage if anything damage to the dura mater, so it's going to affect the CSF. So it because of the damage of the skull and because of the dura mater, meninges, so they may chance to get the CSF rhinoria. That means the CSF is going to leak and also is going to comes out from the nose. So if any leak from the CSF from the nose, it is called as CSF rhinoria. So if sometimes the CSF may leak from the ear canal, so that also called Csf Otoria. That is the two symptoms, two signs we can observe in case of like a skull fractures. If anybody if anybody got the Csf Otoria, Oto means the ear, Csf rhinoria, if the CSF comes from the nose. So these signs importantly we have to observe while assessing the head injury patients. And also in case of may chance to get the epistaxis. Epistaxis means any bleeding from the nose. So they may chance to get the blood as well as may chance to get the CSF. So if it is CSF comes, that is CSF rhinoria, the blood comes with the blood rhinoria and also is called the epistaxis. And also may chance to get the subconjunctival hemorrhage. So conjunctiva also is going to get the hemorrhage. And also another important sign in the anterior skull-based fractures are going to be the Raccoon Eye Sign. So that means the periorbital surrounding to the orbit is going to get the is going to get the bleed. So it's the most common sign. If you see the animal of the raccoon, so we can observe here. So everything color is different, but the high part is going to be color is different. It's a dark color for hearing. So same like if any ecchymosis or any accumulation of the blood surrounding to the orbit, it is called as the Raccoon Eye Sign. This is the most common sign observed in the who are having the anterior skull fracture or maybe frontal bone fractures. And also who are having this anterior skull fractures. So another symptom is they are going to get the insomnia. So that means is a loss of smell sensation. So these are the most common signs. So if we observe these signs, so we can easily diagnose the person having the head injury. So in case of the middle skull fractures, so in the middle skull fractures are going to be also we can easily identify. So these are especially Csf Otoria. So middle skull fractures are going to be the Csf Otoria. So the CSF comes out from the ear canal. So this is called the Csf Otoria. And also because of this middle skull fracture, so it may chance to get the hearing loss. So because of this area is going to be mainly the temporal lobes. So if any damage to the temporal lobe and also may chance to get the hearing loss. Another important sign in case of the middle skull fractures are going to is the battle sign. So battle sign is nothing but is a ecchymosis or hemorrhage and also hematoma occurs behind the ear or also is the mastoid process. So it is called as the battle sign. And also some people may chance to get the facial nerve injury and also vertigo and nystagmus. Vertigo means the reeling sensations. If they sit or stand, they're going to feel the giddiness. And also nystagmus. Nystagmus is nothing but is the unsteady gaze. Unsteady gaze means they cannot control the sight, the vision cannot gaze or see. They cannot observe the object at one place. So they cannot control the eye movements. Eyes are going to be uncontrolled. Nystagmus means uncontrolled, rapid eye movements. So that is called as it. So these are the most common signs observed who are having the middle skull fracture. So and also next one is in case of the posterior skull fractures. So for posterior skull fractures, so they are going to get the may chance to get the a bruising, and this bruising also may chance to get the different signs. And especially those people are going to give the cranial nerve injuries. So cranial nerve injuries, the 12 pairs of cranial nerve, depends upon the involvement of the cranial nerve, we can see the different symptoms. So for example, if anybody get the injury to the facial nerve, they're going to get the facial nerve palsy. Or in case of, for example, in case of like a trigeminal nerve, they are going to get the trigeminal nerve. So first one is the olfactory nerve, optic nerve, and also oculomotor, trochlear, trigeminal, abducent, facial nerve, and also auditory nerve, hypoglossal nerve, glossopharyngeal nerve, and vagus nerve, and also accessory. So these nerves are going to be, depends upon the involvement, depends upon the nerve involvement, the symptoms will be varied. And also another important diagnostic procedure in the skull fractures, the double ring sign. So this is the common sign we can observe while checking the CSF analysis. So in the CSF analysis, so if we take the CSF, if we collect and also if we analyze the CSF, so the CSF is separated from the blade when it is placed on the filtered paper. While assessment, so if we keep the CSF on the filter paper, so automatically is going to separate it from the blade. So this is the main is a sign we can commonly see in case of the skull fractures. So this is also called as the double ring sign, also called as the halo sign. These are the classical signs in the skull fractures. First one is the CSF Otoria. Otoria means the CSF come from the ear canal. CSF rhinoria, CSF come from the nose. And also Raccoon Eye Sign. Raccoon Eye Sign means the bleeding around the orbit or ecchymosis around the orbit. And also next one is the battle sign. If any bleeding behind the ear. So these are the major signs, and also this is the double ring sign. So these 5 signs we can commonly observe in case of the skull fractures. So without checking the any other diagnostic procedures such as CT scan and MRI scan also. So if we see these signs, we can easily understand the patient having the how much severity got the head injury. So this is about the skull fractures.